Well, welcome back. My name is Dr. Rich Suplita. I'm here with the literacy volunteers of Harrison County. Be sure to like and subscribe to the station here below on YouTube. Today we want to talk a little bit about ADHD, or Attention Deficit Hyperactivity Disorder. This is something that most people have a little bit of familiarity with. We want to talk about some symptoms and some treatments of this disorder, and also a little bit about what is going on in the brain. Okay, so ADHD is classified as a developmental disorder, and what this means is that true cases or true instances of ADHD are something that is part of the way that person processes information, and it's present from the time that they're a very young child. Now, we'll talk throughout the video about something called clinical significance or severity. Everybody has some attentional problems every now and then. It's very common for people to say, oh, well, I'm ADD or I'm ADHD. But a true clinically significant case of ADHD is going to start presenting problems. There's going to be some evidence from before age 7 or 8. Okay. In terms of diagnosis, boys and also men into adulthood are much more likely to receive a diagnosis of ADHD than girls or women are. In school-age boys, the percentage is about 5 to 8%, but somewhere between 5 and 8% of school-age boys would meet the diagnostic criteria for ADHD, whereas with girls it's only between 2 and 4%. And this continues into adulthood. Men are about twice as likely as women to receive a diagnosis of adult ADHD. About half of the cases of childhood ADHD will extend into clinically significant symptoms that continue into adulthood. Okay, and so what are some of those symptoms in adult ADHD? It's going to look a little bit different than it did in childhood, but what we see is that people with adult ADHD are more likely to have sort of tumultuous relationships. If they're married, they're more likely to get divorced. They're more likely to have been married and divorced a number of times. Occupationally, they are more frequently fired from jobs and or to change jobs. And then finally, there tends to be a mismatch very often between people who are either highly skilled or highly educated who have ADHD and their occupational success, and so they tend to underperform chronically. ADHD is highly comorbid. What this word comorbidity means is that there is more than one psychological diagnosis in the same person. So it's highly comorbid with anxiety disorders, things like obsessive compulsive disorder, but also anxiety and depression. It's highly comorbid with substance abuse disorders. And I don't have it on there, but it's also highly comorbid with certain personality disorders like antisocial personality disorder. Okay, so let's talk a little bit about the symptoms of ADHD. This is not a comprehensive list. This is easy to find the list online if you just type in symptoms of ADHD. And the ones that are officially recognized would be found in something called the DSM-5. DSM stands for Diagnostic and Statistical Manual. It's sort of the Bible of psychiatry and psychology in the United States. So some of the more prevalent symptoms include failure to give close attention in one's work. Okay, this could either be academically for a child or a college student, or it could be occupationally for an adult. They often make careless mistakes, right? Overlooking things that should have caught their attention. Okay, they have a hard time, a difficulty in organizing tasks, especially in a complex problem or a complex assignment, knowing how to structure, okay, we need to do A first and then B before we do C. They can really struggle with those types of tasks. In children especially, boys more than girls, they tend to be fidgety and squirmy and act out. Again, that's sort of boys in general, but what we're looking for with ADHD is a higher prevalence of those types of symptoms. In both children and adults, you see a high degree of impulsiveness, blurting out answers, okay, interrupting other people while they're speaking, an inability to wait your turn. Those can be highly symptomatic of ADHD. With adults, you'll see things even, we mentioned before, but a higher likelihood of abusing substances. You can see more sexual acting out in people with ADHD. So impulsivity in general can be a problem. And what we're going to see for a diagnosis is an impairment, a clinically significant impairment, meaning this is really causing the person some major trouble in their life in 2 or more areas. And so the areas are school or academically, socially, occupationally, and in terms of the family. So for example, if a person only had problems at school and nowhere else, then they probably wouldn't warrant the diagnosis of ADHD. All right. So let's take a little closer look at what's happening in the brain real quick. Of course, there's a whole lot you can say. I'm trying to be very simple here. But in general, what you see happening in the brain is something called cortical hypoarousal. That's fancy scientific talk. What does that mean? That means that the cortex of the brain, in particular the prefrontal cortex, right, those brain areas right above the sockets of the eye, are not functioning as strongly as they should. Okay, there's a weak neural signal there in the prefrontal cortex. And we talked before about what the prefrontal cortex does, some very important roles, just in terms of normal activity. Also the video we did on drug addiction, we talked about the same area of the brain. The prefrontal cortex is critical for what we call executive functions of the brain, executive roles, things like planning, right? But also behavioral inhibition, inhibiting inappropriate behaviors or behaviors that are likely to lead to a bad outcome. You need a strong prefrontal cortex in order to plan and also in order to inhibit inappropriate behaviors. And those areas tend to be relatively weak in untreated ADHD. Now, on more of a molecular level, we're going to again look at the dopamine system. So obviously dopamine keeps coming up in these talks. It's a very important neurotransmitter system for psychiatry and psychology, and we see it again here in ADHD. In general with ADHD, what we see is low, okay, suppressed or lowered dopamine activity. This can be very often for genetic reasons. I forgot to mention earlier, there's about, in terms of genetics, heritability, ADHD is at the top of the list, literally, of psychological disorders. So it's higher than depression, higher than anxiety, higher than OCD. ADHD is very, very strongly inherited, okay? So low dopamine activity can lead to motivational issues because the dopamine system is the main motivation system of the brain, and this can spill over into a difficult time initiating tasks. Untreated ADHD, a lot of folks with that condition have a really hard time being self-starters, okay? So a lot of times once they're given structure, once it's showed them what they need to do and how to start, they can function very highly, but they have a hard time doing that on their own. The second system we want to talk a little bit about, another neurotransmitter system in the brain, is the norepinephrine system. So whereas dopamine is more about motivation, norepinephrine is more about attention, maintaining or sustaining attention, remaining on task. Okay, so low norepinephrine tone can lead to skipping around from one activity to the next and not completing assignments or tasks. Okay, and so a person with low norepinephrine is very easily distractible. And so finally, we want to talk just a little bit about treatments. And as is the norm in psychiatry and psychology, there tends to be more of the cognitive behavioral treatments than there tends to be more of the drug or the pharmacological treatments, and often they're actually combined. And so most people have heard at least about a few of these ADHD drugs. And these drugs tend to be drugs that boost norepinephrine and dopamine. Some drugs will focus more on one of those than another. And some of them will, some drugs actually will increase activity in dopamine, norepinephrine, I don't have it on here, but also the serotonin system. So a good example of a drug that's very commonly used to treat ADHD, especially in children, is Ritalin. The drug name, or the generic name, is methylphenidate. And what that drug is going to do is, again, it's going to increase the synaptic, in between neurons in the brain. It's going to increase the amount of dopamine, norepinephrine, and serotonin. Another one that's very common is Adderall. The drug name is mixed amphetamine salts, and by the same token, Adderall is going to increase levels of dopamine, norepinephrine, and serotonin in the brain cells. These are very effective drugs. One concern when these drugs first came out was, well, if you're giving a child a drug that actually is a drug that might be abused by adults, well, won't that increase the likelihood that that child will go on to struggle with substance abuse issues as an adolescent, teenager, adult? That turns out not to be the case. If anything, children who are maintained on these drugs and supervised, they're used in a cautious way, tend to have lower abuse of drugs as an adult. So they are very effective at treating the symptoms, but you do have to be cautious of abuse potential, right? Because taking a high dose can actually cause some very negative symptoms. Another issue with drug treatment is tolerance and sensitization. And what tolerance means is that the same dose of the drug will actually have a lesser effect. And so if you want to sustain the same amount of effect, you're going to need a higher dose. Now that tends to, the problem here with drugs like Adderall is that we tend to get tolerance for the motivation and attentional effects of Adderall, but you tend to get sensitization for the ability of these drugs to produce things like anxiety or depression. Okay, so over time, the same dose is more apt to cause a higher degree of anxiety. So this is why it's very well advised for kids, especially who are on these drugs, to have drug holidays. Take the weekends off, take summer off, take spring break off, and not take the drug so the brain has time to readjust. And finally, cognitive behavioral therapy. There's all sorts of subtypes of this, but in general what we're talking about is teaching the person how to structure their life, teaching them how to get started, right? Teaching them proper behaviors, something as simple as eating healthy, exercising, getting a good quality of sleep. All of these things can very powerfully help adapt or address the issues of ADHD. And so what I would recommend, of course, if you are speculating, maybe you're wondering if you yourself, even as an adult, has a problem with ADHD, or a child, have that child taken in and get interviewed. There's psychological tests they can do, a battery of tests, and a trained professional, a neuropsychologist or a psychologist or a psychiatrist, can make this diagnosis and help you address this problem in a way that will definitely lead to an improvement in the quality of life. So thank you for joining us again today. My name is Dr. Rich Suplita with the Literacy Volunteers of Harrison County. Thank you.